Hello, my name is Santiago Chambers, and today I'm here to talk about my Week 5 assignment, which is going to focus on improving care for veterans. I'm a student in Health and Human Services 497, Capstone course with Dr. Rebecca Wilson, HHS 497, Health and Human Services Capstone. And today is December 14th, 2022. Going into the Week 5 assignment, I'd like to start by saying that the VA is charged with caring for our country's servicemen when they're discharged from the military. Like myself, I served in the United States Navy for 4 years. I'm fortunate to be able to afford health care and to use private health care, but for many veterans, they rely on the Veteran Administration medical centers to provide their medical, vision, dental care, and even psychiatric care. A number of veterans have served and experienced post-traumatic stress disorder. They are homeless, they're houseless, they have substance abuse issues, and all of these further exacerbate their other conditions. Some were injured and were involved in wars that caused them to experience being blown up during improvised explosive devices, or they may have been put in battle zone conditions. They deserve the best care. And what I intend to capture in my Week 5 assignment is just, again, the importance of us to take care of our veterans. What I've noticed is that the VA system is a bit antiquated, and the times I did call, usually it was long calls, it was press 1, press 2, you were being transferred, and it was very difficult to get a live operator. Logistically, it's hard for people, especially veterans in rural areas, to find access to a close VA center. So trying to get a cab or trying to get an Uber or a Lyft or get a ride to the VA to get medical attention is almost impossible for them. And so my paper will highlight some of the challenges with logistics for veterans getting to and from their appointments. Not being diagnosed also contributes to their problems. And so what we have are a lot of veterans that are on the streets, again, suffering. We owe our veterans more than what we're doing, and dismantling the VA and its service lines is essential to providing the premium and timely health care that our veterans deserve. Of the many veterans in need of services are those that are homeless, to the point I made early. Many are homeless on the street as a consequence of PTSD from war, substance abuse, and mental illness. My thesis statement starts off and reads as this: antiquated and aging VA medical centers must integrate technology, customer service, self-care into their practice to improve conditions for veterans. Including veterans and health and human services professionals, and that's us, into the VA care planning can help contribute to early diagnosis, treatment, and overall quality of life. My reference is the Veterans Administration Directive 2009 through 38, the VHA National Dual Care Policy, and that can be found at http://www.va.gov under VHA Publications. And that article is October 10, 2012 as an additional reference. I noted with that reference that dual care patients are often referred to who's to receive care from both the community and VA health systems. Dual care management is important because it involves the human service worker and it links them with the VA services. That's our role, is to connect them and link them to resources. Another reference that I have is Gulliford and Morgan, and it's called What is the Continuity of Care? And this could be found in the Journal of Health Services Research and Policy, and that reference is in 2006. The practice of obtaining healthcare services from more than one source is a double-edged sword, and it could improve the access and provide more choices for the patients. And that's where we want to do, and where we want to be, is helping veterans have more options. One more reference for you is Hester and Cook and then Robbins with the VA and Medicare HMOs complementary or redundant. This can be found in the New England Journal of Medicine, and it was also very helpful, and it promotes well-coordinated care from expert care providers that specialize in the needs of homeless people. I intend to capture all of this in my report and highlight again the importance of assisting our veterans. They deserve the best, and it's up to us as health and human services professionals to advocate for our veterans. I thank you for your time, and I look forward to your feedback. Thank you.